You're listening to the official OSAP podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Hello and welcome back. I'm Michelle Lee, your host, and I am so honored today to have as my guest none other than Mary Gavoni. And let me tell you, don't laugh, Mary. Let me tell you a little bit about Mary because I love her background. She is a certified dental assistant, a registered dental assistant, a registered dental hygienist, and has her MBA. I mean, what else could you do, Mary? What an amazing background. But she is a member of a life member of the American Dental Assistants Association, a member of the Dental Hygiene Association. She is a member of OSAP, of course, and she speaks internationally. And this past year, we were just discussing it. She has been quite busy giving webinar after webinar after webinar during this crazy pandemic. But you've lived to tell about it, Mary. So welcome.
Thank you very much, Michelle. You're right. It's been crazy. One thing I have found is that I really do like working from home. I like not having that part-time job of, schlepping to the airport and, going off someplace and coming back home. It takes up so much time. So it's not all bad. If there's any kind of silver lining, I think it's that.
Yes.
Got to stay home more.
I can relate to that. I've been kind of happy to not be fighting that airport, but that's coming back to my life really soon and probably to yours as well.
It is. It is.
Yes. So tell us, how did infection control education become your passion?
Oh, wow. Mostly by default. In the late 1980s, when we started learning about HIV and AIDS, and when we had issues with hepatitis B outbreaks in dental practices and things started changing, I owned a staffing service in Michigan where I lived at the time. And so I had at any given time, 150 to 200 dental assistants and hygienists and some administrative team members as well that were my employees. And they were going out into practices where maybe we hadn't had a time to go and visit the practice and see how things were on it for them to go on a temporary basis. And they were coming back and just telling us horror stories about what was going on. And around the same time, I was the president of the American Dental Assistants Association and had the opportunity to attend an OSAP meeting. And from there, I was hooked. And it served me so well to have the training and the education that I needed to help educate my temporary employees and my clients who in many cases didn't understand any of the new guidelines or OSHA rules that were coming out regarding infection prevention and control.
Well, Mary, you know what I say every time I do one of these podcasts, I learn something new. I did not know you owned a staffing company. That was my career for 29 years.
Oh my goodness.
A dental staffing company in Atlanta.
Oh.
So we have never connected on that. So
we have not.
That is a whole nother conversation you and I are going to have.
Was it Dental Power by any chance?
No, it was started by a dental hygienist. So it was it wasn't a franchise, but it was DDS Staffing Resources based here in Atlanta. And I started there right out of college, and I didn't have dental experience. And so I was put into dental assisting classes at night to learn terminology to learn dentistry. But I can relate at that time because I was coming in right when I started in 88. So right when OSHA was coming out with bloodborne pathogens, everything you just said went through that. And that's how I learned about OSAP. because we provided training also for our customers.
Sure.
And hired someone that a lot of our listeners probably know, Jackie Dorst, who was an OSAP member, and she did training.
Yeah.
Worked with us for 20 years, helping train our clients.
Fabulous. Yeah.
Yeah. Small world. I love that.
It is. I love it too.
Yes. Well, so tell me, what are you seeing today? What are you hearing from practices and from dental professionals? What are the questions they're having? Are there still some misunderstandings? I mean, thank goodness most people are doing the right things because we're safe. The reports are coming out that dentistry is safe. So that's a great thing.
I think so. What I'm hearing the most right now are people who are discontinuing screening patients. They're discontinuing screening employees, and they're not requiring, in some cases, their patients to come into the facility with a face mask. They're not requiring them to wear a mask because they're, I think, mistaking the guidance that's been issued by the CDC for public settings and not realizing, and I direct them right to the language in the documents that came out in April and then in May, that it says it doesn't apply to healthcare settings. Now, granted, it seems like a whole previous life since we got the last dentistry update from CDC, December of last year. And I keep telling people, we're probably going to get an update soon. We just don't know when.
Yes.
And many people don't want to wait for the update. And so they're dropping a lot of those things. And I keep saying, no. You have to keep following CDC guidance. That's what OSHA wants you to be doing.
Yes.
And you just going to have to be patient. But I think so many people have reached the end of their rope. They don't have patience with any kind of COVID restrictions anymore. And hopefully we don't see some exposures that take place as a result of that. But I also see a fair number of dental team members who are hesitant about the vaccine. They just don't want to get it. They don't think it's safe. And that's sort of disheartening to me. I wish we could get closer to 100% of our dental team members vaccinated, but I don't think that's going to happen.
Yeah, unfortunately, I'm hearing the same thing, that the numbers are, there's still a lot of people they're worried about, if they've never had children, is that going to affect it? And I do know there's a webinar out there called Oh Baby that the ADA put together.
Yes.
And it was excellent. And anyone can, it's open to anyone, not just ADA members. So you can do a quick Google search of ADA Oh Baby, and it was great information for people about how the vaccine is safe for young women. Yes.
Yeah. And I can understand that if someone, especially if they were trying to conceive, being hesitant, but other folks but it's almost the same number of people or the same people altogether that are hesitant about influenza vaccines, and they don't feel that they're susceptible. They think they can get the flu from the vaccine, or I don't know if they believe they can get COVID from the vaccine, but that's disconcerting.
Yeah, it's that part is very challenging, I think, for a lot. And I've heard that from a lot of dental practice owners about how to talk to their patients talk to their employees about the vaccine. And because it is a very personal decision.
Yeah. And we also hear a lot of questions about whether employers can require proof of vaccination, and whether they should disclose to patients if their team is vaccinated, whether they should ask patients if they've been vaccinated. And, certainly they can ask patients if they've been vaccinated. And I think it's really up to the team members if they want to disclose that information. I've read some things that say it's not protected by HIPAA, but if I were working in a practice and I was not vaccinated, I'm not sure that I would appreciate my employer sharing that with my patients, because it could certainly cause some concern. But yeah, I think that the one thing I think that's affected all of us in dentistry is that we tend to be the type of people that don't like change. We want it, tell me the black and white answer. And we've had so much gray area, and people forget that this is all new. We've never had a pandemic on this scale in this country before. And this is a new virus, so we're still learning about it. And yes, the guidance from CDC has changed rapidly up until now for us in dentistry, that people think, oh, okay, I just got this down and now the CDC changed it. Well, they changed it for good reason, because they found out new information. And I think folks lose sight of that. Sure. They've not really followed a lot of CDC guidance in the past, because, as you know, that nasty little word recommendation trips everybody up all the time. Well, it's just a recommendation. I don't have to do it. I'm like, yeah, you do.
Yeah, well, and in some states, I believe in some states, if it's written into their practice act, it does become a requirement and not just a recommendation, right?
Absolutely, yes. Yeah. And as I was doing some research, I came across some information from OSHA a few weeks ago that is part of their enforcement guidance for inspections, and it clearly says that they expect healthcare providers to follow CDC guidelines and guidance. So that's what OSHA is looking for as well. And just because it says it's recommended doesn't mean it's not the right thing to do, and that it's not something that can be optional. Well, I don't have to do that because it's just a recommendation. Careful, careful, careful. They need to be looking at liability if something should happen.
Absolutely. Great risk management, right?
Yeah, absolutely.
That's it. Well, going back to guidance, pre-pandemic, the normal guidance that was out there, in the summary that came out in 2016, it was included that it's recommended that every dental practice have a designated infection control coordinator.
Yes.
Right. And I don't know if you're like me and you continue to hear, there's a lot of offices that still don't have that individual.
They don't.
So, what would you say if an assistant or a dental hygienist came to you and said, listen, I know we don't have this position. I would like to have this position. How should they go about that?
Well, I think it has to be something that's approached with the entire team together, and not just a one-on-one with the doctor, because many times the doctors are busy or distracted by other things, like, later, we'll talk about that later. But if it's discussed perhaps at a team meeting that, this is in the CDC guidelines, and because the information is changing rapidly and we need to stay on top of this and make sure that we're providing the safest environment for us and our patients, can we consider, implementing this? And maybe it's going to be something that person who brings it up gets volunteered to do. But the reality is that as a consultant going into practices, what I see is that there's usually no one in charge. If we don't, and OSHA requires somebody to be appointed as the safety manager. So it perhaps could be the same person. Or it could be a shared function, but someone has to be in charge to know what to do if something goes wrong. And last summer, for some reason, I got a lot of questions from folks about packages of instruments where the indicators didn't show that they had been successfully processed. And they're like, okay, now what do? We already used the instruments on the patient, and we discovered after the fact, we're cleaning up the room, oh my gosh, the color change didn't take place. Now what do? Well, nobody knows what to do because they don't have a written protocol and they've never discussed this before. So I think more than ever, this is a really, really important position, but anyone who brings this up as a suggestion, I think, is going to need the support, not only of their doctor or employer, but everyone else on the team to make it happen, because the rest of the team members are going to have to look to that person as the leader and accept feedback from them if perhaps things aren't being done correctly. And then that's something that I think needs to be leveraged to the patients always. That, Mary is our infection control coordinator in the practice. If you have any questions, if you ever have any concerns, please let her know or let us know, and we'll refer you to her. That I think it just gives patients a good sense of confidence in what we're doing.
Oh, absolutely. I've said that for a long time, that I think that team members should, especially when they have new patients come in, they should show them what they're doing to keep them and their family safe. Use it as a marketing tool as well, right?
Always. Absolutely. I think, putting things on social media and on their website, and especially with new patients, I had to find a new dentist here in Wichita because my dentist back in Michigan was just a little far away, and then he retired. So I asked a lot of questions before I went, and
I bet.
and I told them, full disclosure, I said, this is what I do. So I'm probably going to be a little more critical, but they were fabulous in showing me what they do and in those types of things. But I did find that they weren't screening patients anymore. And so, well, you're still supposed to be doing that and taking temperatures. So, no, there's no place that's perfect, but at least, as you said, market that, make sure that you're very proactive about that. Especially now, I think dental practices came under a lot of scrutiny back in the early days of bloodborne pathogens. And of course, all the information about the HIV transmission in Florida. And then we kind of got a little lax about that over the last maybe 15 years or so until now. And now patients are very aware, maybe hyper aware of infection prevention and control in practices. So more important time.
Patients even know what PPE stands for now, don't they?
No kidding. No kidding. And I think there can't be too many people on the planet who do not about the CDC, love them or hate them. They still, they're mainstream. And I kept thinking the same thing that you said, is like everybody in the world knows what PPE is. When Stephen Colbert is talking about PPE on his Late Show, we know it's become mainstream. Absolutely.
Yes. Oh my gosh. Well, Mary, I'd love for you to tell us about another new venture you have right now, which is a podcast I've heard about. Yes. Tell me about that.
Okay. Well, during the course of the pandemic, many of those of us who are consultants and trainers in offices would share information with each other or question. And so Leslie Canham and Linda Harvey and Olivia Wan, all longtime OSAP members, and I were emailing each other back and forth. Well, I heard this, or I found this document. What do you think? And our main concern was making sure that the information that we were sharing was consistent and accurate and based in guidelines and science, as our dear friend John Molinari would say. And we started having regular Monday morning meetings. Here's what, I found last week, whatever. And then we participated in a town hall presentation with Hugh Freedy, one of our long-term companies that support OSAP. And after we did our prep for that, we decided, we need to keep this going because it's so helpful. And so as it evolved, we decided, okay, we're just going to start a podcast and try to get this information out on a weekly basis. And we were just sort of joking around one day, and we said, you know what? We've become the compliance divas. And so that's the name that we adopted.
I love it.
And just sort of tongue in cheek. And then we designed a caricature around it. And so we've just this week launched our first podcast. And so we're looking forward to many more. And it's really a lot of fun. It's a lot of work, as we found out behind the scenes, to get everything set up to be able to do the podcasting. and be listed in directories and so forth. But really a lot of fun. And we're hoping that we'll be able perhaps to have an interview with you, our OSAP executive director, at some point, because we want to promote the benefits of OSAP to dental practices all throughout the country and throughout the world, so that they understand that OSAP is such an invaluable resource for everyone.
Well, we definitely appreciate that. And, tying that back into infection control coordinators, my gosh, if you're an infection control coordinator, OSAP is just right where you need to be to have all the resources at your fingertips. So
absolutely.
Yes, but I cannot wait to subscribe to your podcast. I do some evening walks, and even last night I was listening to a dental podcast, and I came back in and it's 8:30. I was so motivated and pumped up from listening to this dental podcast. My husband said, "What are you doing?" I'm like, "I'm shooting off emails. I've got some new ideas." So I'm sure listening to the four of you, I will have even more ideas.
Oh, yes. Good. And it's interesting because we have such a wide range of expertise. Olivia is an attorney, besides being a dental assistant and a consultant. And Linda Harvey has this extensive background in risk management. And Leslie and I have dental assisting background. I have additionally some dental hygiene background, so more of a clinical experience. So we just thought it was a good blend, a good mix. And we're very, very excited. Again, just wanting to get information out there that's accurate and dispelling myths and so forth, and something that people can depend on to listen to. Right. And we're so excited about the OSAP conference coming up that one of our episodes will be dedicated to all the new things we learned at the OSAP annual conference.
Oh, that is wonderful. Yeah. That'll be a great one. Yes. So probably by the time this podcast has aired, the conference will have occurred. And so you'll definitely want to, if you didn't get to attend the conference, you'll want to tune in to the Compliance Divas podcast to hear what you missed.
Yep. And anyone can subscribe. They can go to thecompliancedivas.com, and right from the homepage, you can click on subscribe and it will take you right to all the podcasts.
I am doing that as soon as we finish here today. I'm really excited about that. Yes. Well, good. Mary, thank you so much for taking time to join us today.
Oh, thanks for having me.
And, I just think any little bit of correct information that we can share with the world will make a difference.
Absolutely. That's what we're there for.
Great. And thank all of you for tuning in. And if you are interested in membership, please go to osap.org and click on the membership tab. And we've got a lot of great things coming up. We're launching a brand new website August 1st and a new learning management system. So there's going to be even more educational opportunities for dental professionals on our website. So we're real excited about that. But until next time, stay safe. Thanks.